Hi, I am Dr. Chanchal Bhor, dermatologist from Calcutta. First, I will give thanks to mankind for creating such a beautiful platform where general people can be aware about the skin and hair health, and so that they can maintain their skin health as well as health of the hairs. It's a beautiful platform. Next, I will give another thanks to them for giving me a chance to have a live program at this platform. Thank you, mankind. I am here today to talk a few things about acne vulgaris. Actually, acne vulgaris, it occurs in the adolescents, male and females. It starts from adolescence because it is mainly due to the androgenic hormone. There are few cases where we can see acne vulgaris in case of infants also, and that is due to maternal hormone, but it goes away automatically. In case of acne vulgaris in males and females, usually we see that they are suffering from oily skin, but sometimes it can also be seen in dry skin also, where the skin is getting compromised, mainly due to excessive use of various types of face wash repeatedly. In case of acne vulgaris, there it may be a papular, it may be pustular, it may be a combination type of thing. There may be papulopustular acne, there may be nodular acne also. And nowadays, it has been maskne, that is acne due to regular use of mask for a very long time. It is occurring recurrently and regularly to the patients. But usually we can see acne in case of adults. We ask the adult to use a face wash, good face wash, usually which contains a pH value of 5.5, or a face wash which has salicylic acid either 1% or 2%. Sometimes we also add glycolic acid and other things so that the skin does not get too much dry. We also use some antibiotics like doxycycline, azithromycin, and some other newer antibiotics, and that depends on the dermatologist who is seeing the patient. Don't take any medicine as an OTC product from any shop, because always consult a doctor, otherwise you may suffer from another disaster of your skin. Next, we also use some ointment or creams or gels for this reduction of our acne. Various types of gels and creams are now available, called which may contain adapalene, which may contain benzoic acid, etc., etc. Various types of things we are using to reduce our acne problem. Nowadays also we are using some moisturizing creams or gels also, which has no oil, because oil can induce more acne, as acne vulgaris is a disease of the sebaceous gland. With the advent of adolescence, what happens, actually the sebaceous glands get blocked, their mouth get blocked by keratin particles, and which produce the papules, or the sebum gets accumulated within the sebaceous gland, and there lies the pathology. So our main motto will be to reduce the sebaceous gland activity and to open the pores. This is very, very important. Otherwise, the patient will suffer from another infection, and that will cause pustules, pains, and all types of problem for the patient. So now it is also using any type of some moisturizer also which doesn't contain any type of oily things. And in case of maskne, before wearing the mask, we should use some moisturizer, aqueous based moisturizer. Whenever we should use any sunscreen also, while going out, the sunscreen should be aqueous based. It should not contain any oil. Regular face wash at least twice a day is enough to make your skin healthy. Don't rub it too much, just apply it and wash your face. Otherwise, you can use your face with plain water also in other times if you feel dirty, because too much use of face wash will also remove the commensal bacteria of the skin, which may create problems. So you should be cautious about all these things. But you should consult a dermatologist before using anything, and if there is acne vulgaris. Sometimes polycystic ovarian syndrome in case of females and other androgen producing tumors can also produce too much of acne vulgaris. And nowadays too much patients are coming with polycystic ovary with acne on their face, on their back as well as chest. So we should consult, we should see whether there is any polycystic ovary or not. If there is thyroid disorder, that also to be consulted. Patient should be advised on a balanced diet, to take plenty of water and not to use other home remedies, because that may create other problems for this. Acne can also cause some post-acne hyperpigmentation or post-acne scars that should be treated also. After treating the acne vulgaris, we should go for the treatment of post-acne hyperpigmentation or post-acne scars. Otherwise, it may happen. Otherwise, there may be some, because in case of post-acne hyperpigmentation, we have to use something to remove the pigmentation, as well as for the scar, we have to go for either glycolic acid pills or microdermabrasion that may create infection. So we should be cautious to treat this type of patients who are coming with post-acne hyperpigmentation as well as post-acne scars. This is in short actually, but again I am telling that we should not use anything oily. We should use a sunscreen or moisturizer which should not contain any oil, and a face wash that should contain the pH value of 5.5. Whatever may be the composition, may contain salicylic acid or glycolic acid, whichever it may be. Glycolic acid peel is also or salicylic peel is also a good treatment for severe acne vulgaris, and actually the cases vary, so the treatment also varies from patient to patients. Thank you. If any question, please ask. I will try to answer all the questions. No food restriction actually. I don't believe in any food restriction. No food restriction is needed. Showman, I have seen your question. You don't need any food restriction, but you should see that your weight doesn't increase. Weight should be ideal for the height of the and age of the body. There are various creams and are available to remove the post-acne hyperpigmentation, mainly which contain the kojic acid. We use all these things. Kojic acid containing cream we use for the post-acne hyperpigmentation. Shajit, every product is almost available, but you should consult a dermatologist first. Showman, there are various soaps which contain pH 5.5, but not the cosmetic soaps. I can't name, but you should see the soaps which contain pH value, which has a pH value of 5.5. Lots are now available in the medical shops. Yeah, bad sleeping habit is a problem. Sometimes anxiety and bad sleeping habits, if the diurnal rhythm is disturbed, then the acne vulgaris can precipitate, because then the androgenic hormones secretion also get increased, and almost every disease is actually uh, depend on our psyche. So if the androgenic hormone get increased, then sebaceous glands also get hyperactive, so there may be some flurries of the acne vulgaris. For the scar, actually you have to go for microdermabrasion. That is the best treatment. Actually it requires treatment in a monthly basis. At least 15 to 16 sittings are required per month, at least one, at least 3 weeks interval. There should be a 3 weeks interval between the sittings. Yes, weather effects. Usually acne vulgaris mainly occur in the summer season, because at that time our face gets too much of oiliness. But dry skin can also, if there is compromised skin, there may be acne vulgaris, because compromised skin is always is a place for the various types of bacteria and fungus. If there is acne during pregnancy, yes, there may be. We should use some face wash. No oral medication is required. Moisturizer, if it contains oily product, then it can cause acne vulgaris. The moisturizer should be water based. Otherwise, there will be acne, more and more acne. Evanti, I have told you that to remove the scar, you should go for microdermabrasion under a good dermatologist. Mister, you have to wear the mask. N95 is the best mask at present available, but you have to use a moisturizer, that means aqueous based moisturizer, so that you don't get maskne, to avoid the acne vulgaris due to mask. Various types of face wash are available for daily use. As I have told that the pH value of the face wash should be 5.5 only. Joy, yes, you can go for peeling during the acne treatment because peeling is another treatment of acne in some cases. Rekha, use some water-based moisturizer before wearing the PPE kit. No, drinking milk doesn't cause acne. It's a wrong idea. Anita, I can't say any product's name because I don't know what happened to your face. But you should consult a dermatologist. Otherwise, I can't name any product. Without seeing the patient, it is not good to take the name of any product. Jaydeep, good afternoon. Good afternoon, Saurabh. Good afternoon, Sujay. Yeah, we can take acne medication with fungal treatment at a time, but we should look for drug interaction before prescribing any medicine. Sudarshana, you should use a good face wash for this at least. And use a water based moisturizer so that your skin doesn't get compromised. To prevent post acne scarring, you should not put your fingers or nails on the acne spots. Number one. Number two, you should use one good water based sunscreen and use it judiciously, and also take the treatment for acne vulgaris from a dermatologist. Thank you, Vishwanath. Ajay, actually, there is no diet, but you should see that weight doesn't increase. Thank you, showman. Charonika, there is no best treatment for acne. Actually, treatment varies from patient to patient. Good afternoon, Topon. Pranjal, if you have got some small blackheads in both of your upper arms near shoulder area, then it could be acne, or it may be keratosis pilaris, any of these two. Thank you, Ajay. Good evening, Sheikh Kamran. Kamran, good evening. Yeah, Avipriya's skin acne medication can make skin dry, so there is a chance of compromised skin. So there may be more chance of infection on the skin. There may be some more bacterial infection also. So nowadays we are using some moisturizer also, so that there is no breach of skin. If there is more breach of skin, then there is more chance of getting infections. We should be cautious about this. শুভদীপ, গুড ইভিনিং। ভালো আছি। In post acne treatment, we should use a moisturizer which should be water based moisturizer or aqueous moisturizer, aqueous based moisturizer, not oily one. And we should take plenty of water, so from the inside we can make our skin should not be dry. No, acne is not a genetic disease. It depends on many things, on weather, on our daily habits, it's a lifestyle. All these things are, or there may be some internal other diseases like polycystic ovary or adrenal tumors. Horace, good evening. Good evening, Sushobhan. Yeah, Somen, I am trying to take care of myself as well as to stay safe in this COVID situation. I don't know how many days I will be able to do these things. Good evening, Subhankar. So again, I am giving my thanks, sincere thanks to mankind for creating such a beautiful platform to make general awareness of the people, as well as to give me a chance to talk about a few things about this acne vulgaris and to make everybody aware. Thank you. Good evening. So I am finishing here. Okay. Good evening. Good evening to everybody. Okay, Shima, good evening. Suman, good evening. For daily skin nourishment, main thing is to use face wash twice daily, use a good sunscreen, and as now we are talking about this acne vulgaris, we should use a sunscreen which should be aqueous based. If there is too much of oiliness, then we can use toner also. Otherwise, no need to use toner. As well as we should use a night cream, that is a moisturizer. Again, that should be water based or aqueous based moisturizer. Okay. Thank you, everybody. Okay. Thank you. We are finishing here.